things every woman should have learned about her period. There is such a thing as too much flow. A lot of adolescents get these blowout periods, and they have no idea that they're too heavy, or that there are things they can do to help control them, said Maguire. They just assume that everyone's period is this way. While having a heavy flow is relatively common, and most women tend to bleed more in the first few days, if you find yourself needing to change a pad or tampon more than every 2 to 3 hours, or if your period lasts longer than 7 days, it's likely time to talk to a healthcare provider about your options. Hormonal birth control can help decrease the amount of flow a woman experiences, as can certain pain relievers. There's also a small chance that heavy flow is a sign of menorrhagia, a term used to define periods that are so intense, they keep a woman from doing her usual activities. The bottom line, if you think your flow is abnormally heavy, pain relief requires foresight. For women who have painful periods, and evidence suggests there's a lot of us out there, getting relief from cramping and other common physical symptoms often requires taking over-the-counter pain relievers before any bleeding even starts. If you take medication when the symptoms are already bad, you're behind the ball, said Maguire. If your periods are pretty regular, and if you know you start on a Wednesday or Thursday, for example, I might start dosing on a Tuesday. Research also suggests that certain lifestyle changes, like getting plenty of exercise and sleep, eating healthy foods and finding ways to relax, can help provide some women with some relief. Your period shouldn't mess up your life. In most instances, your period should not keep you from your normal activities, said Dr. Mary Rosser, an assistant professor and attending physician in obstetrics and gynecology at Montefiore Medical Center in the Bronx. Studies have shown that 90% of women will experience some symptoms, but mostly mild, and 10 to 20% will have symptoms that interfere with normal activities. Those symptoms can crop up when you're actively bleeding, or as a part of PMS, which occurs because of hormonal changes in the week or two prior to your period. See your doctor if you have cramps that keep you from doing your normal, daily activities, or PMS symptoms that interfere with your day-to-day. You can get pregnant during your period. It's highly unlikely, but it is possible for you to become pregnant during your period. As Health.com explains, some women have long periods that overlap with the beginning of ovulation, even though they're still menstruating. Or, as Dr. Michelle Hakika, an obgyn and author of Expecting 411, Clear Answers and Smarter Advice for Your Pregnancy, told Parents.com, a woman with a shorter menstrual cycle, 24 days, for example, could have 7 days of bleeding, have intercourse on her final day of bleeding and ovulate 3 days later. Since sperm live for 3 to 5 days, she could definitely get pregnant. You have your own discharge pattern. When it comes to the complete menstrual cycle, every woman has a slightly different pattern. However, most women bleed, then are dry for a few days, then experience a light, mucus-like discharge, pre-ovulation, that becomes increasingly cloudy and thick, a sign that ovulation has likely ended. What's different from one woman to another is the quantity of discharge, Maguire said. It's just like how some people have oily skin, and others have dry skin. Cluing into your own pattern is just good practice, namely so you have a sense of what is happening in your body and can watch out for any changes. Even if you're regular, you might not be totally regular. First things first, there is no one typical cycle. Cycles can range from 21 to 35 days, said Rosser. Teen girls' cycles can last anywhere from 21 to 45 days. And most women do not get their period on the exact same day of the month, Rosser added. That is normal. Think about it, most months have 30 or 31 days in them, so even if your cycle is 100% precise, your period won't start on exactly the same day or date every month. In addition, it is not necessarily uncommon to have 1 or 2 abnormal periods per year, Rosser said, adding that irregular or missed periods can come from a variety of causes, including illness, stress, significant weight loss or gain, or pregnancy. If you are feeling totally fine otherwise, but your period is irregular, it's typically okay to just wait until your next period. she said. But if that irregularity becomes persistent, or if you have any concerns, you should see your healthcare provider. When your mom stopped getting her period matters for you. In many cases, our moms never talked to us about when they went through menopause, said Dr. Shannon Lachlan-Thomaso, an assistant professor of obstetrics and gynecology with the Mayo Clinic, but it has implications for when you might stop getting your period. In fact, the age at which your mother went through menopause is one of the biggest predictors for when you will, Lachlan-Thomaso said. And that's extremely useful information to have, because there's significant range. The average age at which a woman has her last period is 51, but anything between age 40 and 56 is within the normal range, she said.